Welcome to the Lover's Lounge podcast, where we talk to experts and other guests on topics related to love, relationships, and sex. I am your host, Tina Love, and on this episode, we will talk to Dr. Susan Gronski. Very interesting lady. She is a licensed doctor of physical therapy and board-certified pelvic rehabilitation practitioner. She is also the author of Pelvic Pain, the Ultimate Cock Block, and an international teacher and creator of several programs that help men with pelvic pain get their pain-free life back. Dr. Gronski, welcome to the show.
Thank you so much for having me, Tina.
Yes, I would say this was the first time that I'd heard of this topic. I've talked about, prostate cancer and prostatitis and different things like that, but I'd never really heard of pelvic health and pelvic pain for men. So this is really interesting. It's a pretty, I would imagine, serious topic for men because, men don't really like to go to the doctor and talk about this kind of stuff. So I'm hoping that you and I can build some courage around this and can educate men on this topic today and really help men to step out and get help if they are experiencing pelvic pain. So how did you get into this, pelvic health sort of program?
Well, it sort of fell into my lap, no pun intended, but I started physical therapy a decade ago, and I was sort of feeling my way through the different niches that I can get myself into. So I dabbled a little bit in neurology or the inpatient rehab unit, and then I did a little bit of orthopedics in the outpatient rehab. And one day my friend said, "Hey, there's a lady that does women's health, and she is looking for someone to do an internship at her clinic." And when I went to school, we literally only got 1 hour lecture on women's health and incontinence. And that was it. There was no education, 1 hour, a briefing, and there's so much to our pelvises than meets the eye, right? Especially when there's something that is it has drastically changed, or if someone is experiencing pain, as you can imagine, that can be quite distressing. So I took her up on that offer. I was curious, and I said, well, let me check it out. And ever since then, I fell in love with it. And I had I opened up a practice back in Illinois when I was there in 2014. And I had men reach out to me asking for my help. If I were to see them, can I help them? And I said, yeah, why not? And that's kind of where it led me to today, is being an advocate and a voice, taking a stand for men's health, men's pelvic health, because there aren't many outlets for men and their pelvic health related issues, or sexual issues for that matter.
Yeah. And, I can just imagine, because I think I said this earlier, men are the types that, just from what I've seen anyway, they don't really like to go to the doctor just for a toothache or, their throat hurts or something, let alone going because of something happening in the pelvic area. So,
right.
Yeah.
Right. Mm-hmm.
Yeah.
Mm-hmm.
So it's really something. I can imagine they probably will look online and sort of, if they are experiencing something like that, look online and kind of try to assess what might be going on. So what's the dangers of doing that? Like, what's the drawback for looking at online to kind of diagnose and understand what's going on with them?
Yeah, doing the Google MD search, right?
Yes.
Well, it's a good and bad, I would say.
Yeah.
There's catch-22 to using the internet. It's wonderful because we do have information so readily available, but at the same token, you have information that anyone can really post. A lot of the things out there are misrepresented and misinformation, and it can actually feed into the nocebo effect, which is anything negative associated with what you're going through. The expectations of things being resolved or you seeing a light at the end of the tunnel becomes very meek. So I I think the internet is great, but I also think that you need to use it with caution, especially when you're trying to figure out, what's going on, because most likely you're looking up things that are distressing or actually zap the hope out of the situation in terms of a prognosis. So the best thing to do is really get in touch with a qualified health practitioner who can really go through, well, what is pain and what are some of the triggers, what are some of the red flags, and rule out any of those, and then go to a qualified pelvic health practitioner who can really kind of help calm down the threat around what's happening with one's genitals. So
yeah.
I think that's really important. I think, again, the internet is helpful, but in used with caution.
Yeah, just take it with a grain of salt, used with caution. Yeah. So,
Right.
okay, so let's get into, because like I said, this was a total news flash for me. Like, I did not think that men would have this pelvic pain, as you call it. And so, but
Mm-hmm.
there are lots of different types or lots of things associated with this area. So let's really kind of break this down of the different types of problems that a man could have, and then we can get to, like you said, the types of doctors that they probably need to go and see if they are experiencing X, Y, and Z. So let's talk about some of these sort of problems or pain areas.
Great. So I'll first start to describe like what is male pelvic pain. So
Yeah.
let's kind of get a handle on the terms.
Right.
So male pelvic pain is commonly called chronic pelvic pain syndrome, CPPS for short, or it's also known as chronic prostatitis. And in most cases, about 95 to 97% of cases, are not really related to an infection at all. So really the name in itself, prostatitis, can be quite scary,
Yeah.
because when men think about anything prostate, they're thinking cancer.
Yeah.
So that's a big deal. And so I think the name in itself is a misnomer. But again, typically if someone's searching for pain in the pelvis, chronic pelvic pain syndrome, chronic prostatitis, chronic non-bacterial prostatitis, which is non-inflammatory in nature. But the official definition that research, if you read research, will kind of denote as chronic pelvic pain syndrome is having a recurring symptoms lasting more than 3 to 6 months. There is no known cause or pathology, which will typically result in sexual health issues, urinary complaints, and lots of worry and anxiety, just to say the least.
Yeah.
And I also would like to take this opportunity to say that since we're talking about pain, that pain is also defined as both an emotional and sensory experience to an actual or a perceived direct threat. So we can't forget about that psychological component when we're talking about the biology,
Yeah.
right?
Right.
As you can imagine. So, this is actually more common. Having pain in the pelvis for men is actually more common than you would think.
Mm-hmm.
There's actually a well-known national survey from 1990 to 1994 that reported nearly 2 million outpatient visits per year were due to pelvic-related concerns for men, and most of them were again labeled, and I do bunny quotes here, as prostatitis. And again, we know, like I said, 95 to 97% of these cases are not infection related or related to the prostate at all.
Right.
And sadly, they'll still go through several rounds of unnecessary antibiotic treatment, even in the absence of having an infection. So as you can imagine, having unnecessary antibiotic treatment for several rounds poses for several health risks of taking antibiotics unnecessarily.
Yeah. Yeah. Not to mention,
Mm-hmm.
like, does it kind of, if you take it so much, does it, your body kind of become sort of immune to it, or like when you really need to take it, yeah.
Right. Yes, there's the potential of having resistance,
Yeah.
right? Resistance to antibiotics, especially when you need them. When you really need them, you want them
Right.
to work.
Yes.
And also, there are some antibiotics that have some serious side effects like tendinopathies and weakness of tissues and alterations in gut microbacteria and microbiome, which will alter urinary tract microbiome
Oh God, yes.
and bacterial health. So, there are so many repercussions to the unnecessary administration of prescription antibiotics. We know in cases of male pelvic pain, again, after everything has been ruled out, which in most cases it is a diagnosis of exclusion, which means that men do often go through several invasive tests and procedures to come to this conclusion of having, well, you have chronic pelvic pain syndrome, or quote, chronic prostatitis. Again, has nothing to do with the prostate, but we need to have a label for something, a concept. So unfortunately, that's what's stuck in mainstream. And we're really trying, I'm actually trying to just provide more information to say, hey, let's stop blaming and pointing the finger at the prostate when we know that pain in general is a much more complex issue than just a tissue issue.
Okay.
Right.
Yeah. So for the man that's listening right now, or the woman who kind of knows that her husband is or partner is experiencing something. So let's kind of talk about, what they might be experiencing, because I want to make sure that the men that are listening, or the women, know exactly sort of help the man anyway to identify, what's going on. So what might he be experiencing? What might make him sort of start to wonder if there's a problem, and maybe he's already anxious about it right now and he's trying to figure out what's going on?
That's a great question, Tina. So the common pelvic health issues that men face can include pelvic pain. And again, that's an umbrella term, but it could be pain in the groin. It could be pain with sitting. It could be pain with bowel movements. For some, even experiencing pain with sexual function. So having an erection or after ejaculation. So that could, or testicular pain is another one. So anything that involves pain in that region, and also lower abdominal pain, or even low back pain, because we know low back pain and the pelvic area can be correlated with one another. Not necessarily causative, but there is a high correlation of a lot of crosstalk in that area. So you can have low back pain that can refer to, or low back issues, particularly with nerves in that area, that actually refer to the testicle. So when I work with men, I'm always looking out for, okay, what are some of the triggers that are perpetuating this pain cycle? And if we can make things better, then let's do it. So that's some of the pelvic pain related issues. And other things that can happen, of course, when you have something that's unusual or an unpleasant experience down there, then it's not uncommon to have sexual health related issues come up. So things like, erectile dysfunction or premature ejaculation. And I mentioned already having a pain with an erection or with ejaculation. So those are some things, with pain, but they can also occur without pain, right? So a lot of guys will experience, changes in their sexual performance over, any period of time in their lifespan. It can happen at any moment. It's not this one myth that I kind of want to debunk out there that, oh, I'm just getting older, my penis isn't working. It's no big deal. Like, it's just age. And that's not true. No, not at all. I have men that I've worked with in their 80s that have very satisfying penis function and sexual health. And that's not, that is not to blame. And there are things that you can do to help yourself, and pelvic therapy is one of them.
Right. I was going to say, so you actually have two young men, like 18, 20 something years old. The demographics range, so it's not just older men, but you're saying it's younger men too sometimes.
Absolutely. Performance anxiety is quite common as well. Again, across the lifespan, but yes, younger men too experience changes in their sexual function, even libido. But I think, we should probably step back from pathologizing such things and perhaps maybe normalizing the conversation around, well, it's not just your penis that's making the decisions, it's your brain, and the context of any given situation really matters. And so I think, understanding the psychology and the mental aspects associated with physical function or your physiology matters.
Okay.
So we just need to talk about this more. And doctors aren't asking the questions, and even for men who are asked these questions, it's really hard to bring up anything that might be wrong down there, for fear of shame or being, quote, not masculine,
Yeah.
so.
And, I can just imagine just because, as a female, you go to the doctor and, doctors have so many patients. And I know a lot of times I feel like the doctor kind of rushes in and, okay, what's going
Hmm.
on? And they ask all these questions. And, it's like, I don't know, there's just a sense of urgency. Like, let me hurry up and get this patient so I can hurry up and get to the next patient. And,
Right.
it doesn't really lend itself to sort of being comfortable and just kind of bringing up some things to have a conversation
Hmm.
because it just kind of feels rushed. So, I mean, I could imagine for a man too, it probably is the same way. And it's already difficult for him to bring it up because he's
Hmm.
also anticipating, well, if I bring it up, what are they going to do to me now after I've said this, So,
Hmm.
yeah, that's really something. Yeah.
Right. Right. And the other thing to add to that, Tina, is the fear around, well, what could it be? So the I don't want to find out theory, right? Like, I just don't
Right.
want to ask because I don't want to find out.
Right.
And that, I think, plays into the mix as well. So yeah, you bring up some very valid points. And
Yeah.
again, I think we just need to normalize the conversations around sexual health, and because we know it influences our well-being so much,
Right.
so much.
Yeah.
I mean, our pelvis, our private parts, pooping, peeing, and sex are everyday physiological functions,
And pretty
and
important. Yeah.
pretty important, right? Exactly, for survival. I mean, from an evolutionary standpoint, if we didn't have
Right.
that, we'd be,
Yeah.
we wouldn't be here. I don't think
That's
so.
right. That's right.
So it's pretty important, and again, when something does change down there that is unexpected, then it really rings the alarm bells,
That's
and that
right.
can create a lot of distress. It's distress and anxiety around the issue, especially when there are no tests, there are no scans, there's no like etiology for pelvic pain. Like,
Yeah.
you can't just see it on a scan. And I think that in itself, the lack of knowing what's going on or what's happening in your body, and also the prognosis or what can be done for it, and not having that information just keeps that lion in the room.
Oh my
And let's
gosh.
talk about a constant stress response. Yeah,
Yeah.
absolutely.
Okay.
Absolutely.
Yeah.
So,
Well, I was.
but I wanted to kind of go back to your question, because I love tangents. I really,
I
I
know.
do.
I
But
know.
I wanted to mention a couple of other things that, that men might experience, which are common as well, or
Sure.
urinary
Yes.
symptoms,
Yeah.
right? Like,
Yeah. Yeah.
I'm sure you probably experienced, like, I gotta go now, like going to the
Right.
bathroom
The urgency.
frequency,
Yeah.
urgency. Yes. Men experience that too. They can have urgency, frequency, painful urination, or even incontinence. It's not as common as in women in terms of incontinence, but if you did have prostate treatment or prostate cancer treatment or surgery, then that can certainly impact your ability to stay continent with certain activities, and also impact sexual function. Again, which are not uncommon when you have prostate cancer related treatments. So those are some things that a guy will experience. And again, lastly, which we already touched base upon, are issues like anxiety, depression, feeling frustrated, angry, or hopeless
Yeah.
because the situation has no, I guess, there is a lack of understanding around, well, why am I hurting, and why is this happening to me? And I think as a whole, as healthcare providers, and as a healthcare provider myself, I feel we need to do a better job of encompassing more education around this topic, and being all inclusive and treating the person as a whole versus just their symptom.
Yeah.
And then if there isn't anything that you can, if there isn't anything that you can find because you've exhausted what's in your toolbox, well, we just don't, wipe our hands clean, throw in a towel, and say, sorry, you just have to live with this for the rest of your life, because
Right.
just because you don't have the tools to help that person,
Maybe
there are
somebody
many
else.
other
Yeah.
ways to approach this issue, and let's just refer out when in doubt. So,
Yes. That is so
like,
true. Yeah. So,
yeah.
so Dr. Gronsky, what are some of the activities? So we've talked about some of the symptoms or issues that a man might have, but I also want to nail into the types of activities that a man could do that might then bring on such pain also, because as a man is listening right now, I want to also help him to maybe see, oh yeah, I do cycle a lot, and so this might also be a contribution to what's going on. So what are some of those activities that a man could do that might also help lend itself to some of the pain that he's experiencing?
That is an awesome question, and it's a big one. So we're going to do my best to be as broad as possible. And we really don't have a lot of research around this anyway, so I'm just going to kind of give you my opinion on the possible biological mechanisms at play here and what I've done in terms of my research.
Yeah.
But it's really overall health and well-being, right? So diet, lifestyle, nutrition, how's your immune system, relationships. Of course, you can have a trigger like an STD or an STI. But again, not every guy who does have an infection ends up having chronic pelvic pain, right?
Yeah.
They'll get treated and the symptoms will resolve. We really don't know. There is no single known cause for why a guy will get this. There are some research out there that's trying to make sense of that. And one article in particular that I just recently read said that, again, lifestyle habits and physical activity. So if you're sedentary or a couch potato and you're not physically active and you're not exercising, we know that exercise has so many health benefits, like aerobic exercise and strengthening, not only for perhaps, and I say perhaps, in the prevention of chronic pain, but also to help prevent sexual dysfunction as you age. So talk about, aging gracefully and giving yourself the best opportunity to have optimal function later on. It's the decisions that you're making when you're younger that are going to influence these biological processes in the future.
Yeah.
So I think that's one thing. And I already mentioned again the immune system, but it could be an autoimmune trigger. It could be an immune trigger that, again, it could have been an infection. It could have been anywhere in that person's body, because we know the immune system, these cells travel around like policemen of your body everywhere, and they are intimate with your nervous system, and your brain. And so all these factors can play a role in the culmination of events that lead to an experience of pain.
Yeah.
And again, it could be down there, or it could be anywhere else in a person's body. Other things that I should mention are, risky sexcapades. And what I mean by risky sexcapades is, you can have tissue injury down there. Like you can strain your penis. Penis fractures do happen.
Yes.
So there are these things that can happen, and I think just being aware of like your body part, know your limits. If you're practicing it with a new toy or with a new way of experiencing some sexual activity or fun, just know that you should be well educated about your body. And I feel like that's missing too in terms of education out there. Like we don't know how these parts of our bodies work. How should we, if we're into anal play, like how do we warm up for that? Like what to expect, all of that, right? And I think that's not mainstream. I think it's just like, oh, let me just try it. But, you want to be safe about these things and explore with your body in a way that makes you feel confident and comfortable, but also having that communication with your partner as well to know what your red light, green light, and yellow light is, I think those I've seen many men come into my office with, like I said, experiences gone wrong, sexual experiences gone wild, maybe.
Yes, I'd like to hear about those. Man, we need a whole another hour for that. Yeah,
I know.
Yeah. But
can happen too.
Yeah, here's what you just said something that I think I saw a commercial for this, but I just want to make sure. And what you just said kind of made me think, penis sprain. So like, there's a way that a man's penis can like curve or something due to maybe a sprain, or I think I saw a commercial about some kind of issue with the penis where it didn't break, but it was kind of like, oh, it's kind of been hurt. So what is that? I mean, do you know about that?
Are you talking about Peyronie's disease? Is it more of like there's a curvature in the penis?
Yes.
So theories around that, right? We're not sure exactly how that happens. It's it can be trauma related, obviously, because there's a lot of connective tissue and soft tissue in that area. Just like any other part of your body, like you can sprain your ankle, strain your hamstring muscle. That can happen down there as well, because there's a group of muscles and a lot of connective tissue and nerve and blood vessels there. So that can happen down there. So if it's, trauma to the penis, or even post-surgery, which is much more common, if you had like a prostatectomy or any type of surgical procedure in that area, that could be the trigger for having changes within the connective tissue itself that causes things to shorten. And I have to mention here too, belly fat, although it has nothing to do with whether or not you get curvature of your penis. At least I don't think so. But it actually can shrink your penis size, because, your penis will kind of go into the fat of your belly, and it's like an illusion. It'll make your penis look smaller. So, and guys really don't like that, right? So they're actually wanting to lengthen their penis size and not shorten it. So,
so I don't know.
Belly fat, right?
There's an incentive to maybe dropping some pounds.
There is, yes,
so
absolutely.
Then you can kind of, okay, all right. Well,
there is an incentive.
Well, you hear that, guys, right? Okay. All right, so let's keep moving along. I know this is just so interesting. We could talk all day. So, so a man is experiencing these things, and you've kind of broken these different symptoms down, different types of issues, problems that a person might experience. You've talked about maybe some activities or different things that can be going on that could be associated. So now this gentleman is listening, and he's like, okay, so I feel like, yes, there is an issue. So what should his first step be as far as finding a doctor to sort of figure this out? Because I think you've kind of alluded to the fact that, you can go to a doctor and they can kind of diagnose you wrong and get all these antibiotics and stuff. Well, what type of doctor should he first go and see? And then maybe moving into what you do as far as like rehabilitation and that kind of thing.
Absolutely. So most commonly, men will go to their primary care physician or an internist, just like their regular doctor, if they have one, to ask about like, hey, this is what's happening. What will happen after that is, again, it could be a course of antibiotics, but it could be also a referral to a urologist.
Okay.
So I would certainly kind of get in touch with a local urologist, because again, you really want to rule out anything sinister that might be going on, for sure. So definitely getting in touch with a urologist. Now, if you do go see a urologist again, and you've already taken antibiotics, this is where you, as a person who's seeking pain care or help for issues down there, should really be equipped with this education and know that another round of antibiotics is probably not going to do it. And let's save yourself the frustration and also the side effects of taking those pills and your wallet. So I would probably propose, not doing the antibiotic route, but asking what your options are. And if that person that you're seeing and working with is not even mentioning pelvic therapy at all, this is where you could actually help maybe inform the doctor in front of you to say, hey, I heard about this therapy. I'd like to maybe explore this therapy. So pelvic health therapy after that, once you've ruled out, any red flags, then I would certainly start to connect with your local pelvic health therapist. Now, a barrier to that, I think for some men, now I'm not generalizing here, but for some men, there's a lot, when you Google pelvic therapy, a lot comes up for women. Like, it's women's health, it's women therapy. This is a woman's issue. Why am I dealing with this issue? So now you're delving into these social cultural contexts and barriers of, health seeking behavior and outlets for men to get help. So it might be a long time before they even have the courage to reach out to a pelvic therapist for these issues. So that's, I think, one of the things that is important to mention there. So in any case, I do think that even for any guy listening, even if it says, women's health, do inquire, because they might know another therapist who works more with men, like myself. My practice is 99% male-bodied.
Yes.
And that's who I advocate for and who I have a voice for. And I've built my practice around that because I noticed that there was a definite need and a lack of care for men experiencing pain in their private areas.
Wow.
And I wanted to really lessen the shame around that. And I wanted to get this information out sooner than later instead of several years later, which often is the case before, one, they get the appropriate diagnosis of, well, this is a pelvic floor issue. Go see a pelvic therapist, unfortunately. And we're trying to shorten that gap. We're trying to say, hey, we've tried antibiotics. If you do one trial and it doesn't work and you're not getting anywhere, let's not keep beating the dead horse. Let's kind of get a multimodal approach going on the table. And again, multimodal for a multifactorial issue. And it's not black and white. And that's another thing I'd like to tell guys. It's not so black and white, guys. It's not binary. There's, pain is an emergent process, and it's a collection of things that happen, over one's lifetime that may lead to, as I like to call, the perfect storm. Yeah. So it depends, but an individualized multimodal approach has been shown to be way more effective than just chasing symptoms or symptom management.
Okay. All right. So now they're coming to you. And I think men oftentimes sort of anticipate, like, what are they going to do to me? Like, that sometimes, like, in and of itself, keeps a man from even going to the doctor, because they're like, okay, what are they going to do to me? Like, when I tell them that this is going on, like, what's going to happen? So I want to put some men at ease right now, Dr. Gronski. Like, I want them to know what they could expect from somebody like you. They come in and they have determined that there's an issue going on with my testicles, or there's an issue going on with my penis or whatnot. Mm-hmm. So tell me about what you do to the men when they come into your office.
Yeah. So what should guys expect when they see a pelvic health therapist? Let's wipe the sweat off our faces. Okay. Mm-hmm. That's a good point.
Let's dig in.
So,
come on.
Let's do it. Yeah, let's do it. Okay. So guys seeking comprehensive care for pain in the pelvis, they, number one, should expect that their provider listen to them and validate their experience, because oftentimes they are dismissed. They're dismissed by, healthcare providers and also family members, and sadly sometimes friends and family members. So again, I think validating the experience and offering a safe space for a therapeutic collaboration is going to help that person get a better handle on things, a sense of agency, and empower them to be back in control. Because when they're dealing with this, it feels like I have a loss of control. I can't control my body. This is all uncertain. Nobody knows what's going on. And guess what? Everything is like hyper alert, So anywho, and I mentioned already, I think the approach, the treatment approach, in my opinion, should certainly be individualized, and it should be within a framework of, let's look at the biology, let's look at the psychology, and let's look at the social aspects to your pain experience. So that this interpersonal context between you and your therapist can flourish, right? And so I think that's really important. So, okay. So after we establish a trust and I go through pelvic floor 101. So they should certainly be educated on what is the pelvis, what's potentially going on, what are, all the nuances and complexities of the pelvis and how it's all connected. So I like to use models and pictures just to put their mind at ease of, this is what we're going to be looking for or checking out during the assessment. What are your thoughts? And we have a dialogue around this, right? Good, so again, trying to kind of put things at ease, not going straight, finger in the butt like they're used to when they're going to a urologist that checks their prostate. You know what I mean?
Which has a very bad reputation, which I think, again, why men don't even want to go to the doctor. Like, you don't stick that in me,
Yes, absolutely.
But at any rate,
absolutely.
Keep going. I'm sorry. Go ahead.
No, it's okay. It's a very valid point. And many of the people that I work with have expressed that concern as well. Like, it was just, they didn't feel like, I don't want to say cared for, but it was more like, I don't know, maybe dehumanizing almost, or it was just like, you're just a body part. Let's do it. Get it over with. There was no there was none of that. Like, let's build trust and get your body to feel safe here. And anyway, so yes, we digress, but very good point. Okay, so once we get the education and we kind of break the ice a little bit, a physical assessment precedes that. So it's an opportunity at that point to gather more information. And we do that via movement and safe touch. And we explore activities that that person might find challenging, right? What are they hoping to get back to doing? And often it might be sitting, it might be standing, it might be doing their job, it might be driving, it might be sexual function. Most often it is like, I want to be able to have sex or pee without pain.
Yeah.
All valid goals, right?
Mm-hmm.
And so once we establish that together, we define what quote unquote good means for that person. Like, what do we know, what is good for you, and how do we get you back to feeling good and safe in your own body and in your own experience? So really it's all about building up this positive experience in your body again, so that things can calm down and you can feel safe to do these things. So, okay. So once I have consent, of course, getting consent is really important too. Before I even put my hands on anyone, I also ask for consent verbally. Can I do an external pelvic assessment? So what does that mean? We do look at your genitals. Now, depending on who you go to, I am very liberal with the way I work with people. So I'm not shy about touching testicles or touching a penis and really getting that person to connect with their body in that way, again, safely. Because I will also mention that it is not uncommon for people not to even look down there if a guy's having trouble, right? Again, it's like finger in the butt and like, okay, I feel something, nothing's there, nothing's wrong. But somebody really wants them to do a thorough assessment, right? Tell me what's going on. I'm not going crazy. Please look at it. Look at it. Yeah. So I think that's, again, that's being part of the actual thorough examination. So we do an external examination or assessment, and then an internal one. So an internal assessment is actually, again, checking the muscles around the anus, going in rectally to feel for muscles of the pelvis. So you have muscles of the pelvic floor that help you with pooping, peeing, and sex. And we check. We're not there to find gold nuggets or anything. We're there to check for, tenderness. How does this relate to your complaints? Can we change what you're feeling in your body? So all these are opportunities to promote change in that relationship that they have with this experience that's going on. And if we can make things feel good in that moment, right? Like let's for example move with your leg movements, or I'll have you breathe. Let's take some couple of deeper belly breaths. Can you slow your breathing down? I really coach them through the process, because very often, they'll have a very different experience in their body, and bingo, we've tapped into the opportunity to start making shifts.
Yeah.
And I think that's so important. So to summarize that, we don't treat pain with more pain.
Right.
I don't put out a fire with more gasoline. So we want to, again, instill safety and comfort and lessen the shame around body parts. And I've had men 100% tell me, I just want people to treat this part of my body like my nose.
Right.
Like, let's be real, let's be candid. No need to beat around the bush, but be compassionate and be attentive to the bits and parts of me that hurt.
Yeah.
And I think that's what's missing in a lot of these encounters, these medical encounters that men have. So, anywho, so that's what it entails. Now, I will say that most of the reservations that men will confide in me with are getting an erection during a session, right? What happens if I get a boner? What if she gets the wrong impression, right? Because I'm a female therapist, right?
That was going to be my next question. Like, I know it's kind of awkward sometimes, I guess. I mean, I don't know, because I don't know if I was a man, would I want a man doing this or would I want a woman doing this? I don't know, because you got some men that are like, I don't want a man touching me there, But,
right. Good question. And you're right. We need options. And that, again, more outlets, more options for pain care for men. And I know there are more male physical therapists who work with male patients with pelvic pain. So there are more getting trained in this avenue to help men, but not enough. Right. And then there's not even enough female therapists who are willing to explore that avenue, right? And again, you're dealing with your own comfort level and stuff like that with treating male bodies. But essentially, I think we're doing a huge disservice to guys if we don't have options, or we're just afraid to even go there because, and again, reassurance is huge when it comes to helping someone recover and feeling confident in their body again. And you really want a practitioner that understands you and that you can trust and that you can be vulnerable with, right, during that session. Right. So I digress, but erections, I make it like I talk about it before it even happens, if it happens. So, it's kind of like breaking the ice again. Right. Like, so let's put the worry away.
There. Yeah.
Right. Let's just put it out there again. I totally say that. This is during the educational part of our interaction where it's you might experience a physiological reaction. We're touching parts of your body that respond to touch, and it's a normal reaction. You have nerves and reflexes, spinal reflexes that make that happen. I do not take it personal because it's sort of like saying, if a woman is aroused, that she's always wet, or wetness equals how sexually aroused she is. And that's not true, right? That's not true. You don't have to have wetness to denote, you must be sexually aroused or you're ready. Mm-hmm. No. And the same with guys. Like, just because they have an erection doesn't mean that it's associated with any sexual contact or feelings of arousal, because number one, they're coming to you because they are hurting and they don't even want to get an erection because it hurts.
Yeah.
Right. Happens, yeah. So I say, that is completely okay if it happens. If you need a moment, I will step out. I'm here for you. So no big deal. As long as you keep it professional, I'm cool if you're cool. Oh and I respect it. I'm totally like down to earth and saying like, hey, no big deal.
I'm just sitting here thinking, oh my God, I feel so bad for the men that come in because they're like, yeah, I mean, you touching them, maybe stimulating, certain areas, and all of a sudden something happens, and they're probably thinking in their head like, "Oh my God, this is gonna happen! Oh my God, it's gonna happen!"
Right, and they're tensing, and they're tensing, and all, right. So, and guess what, Tina? And guess what? Like, and then this is what. Here's the kicker, and this is the kicker, and then you'll have guys say, well, my therapist, if they've seen somebody else and come to see me, they'll say, well, I've heard people tell me that I'm really tight down there. And it's like so tight, the tightest that they've ever seen. And I'm like, well, how comfortable were you when you were being examined? Let's talk about that first, right? You know what I mean? Yeah. Like if you're worried about like, oh, what if my testicle slips out? Or what if I get a boner? Yeah. You're going to be tensing. And that is totally not objective. That is totally based on context. And we need to consider that. We need to consider that. And we need to consider what we tell people, because guess what? Words are like toothpaste. Once it's out, you ain't putting that back in.
It's like a bullet. Once it's been fired, you can't take it back.
You cannot take it back. Yeah. So watch what you're aiming and where you're aiming, because like it's gonna matter. And that again, it can either help the person or actually be counterproductive to the recovery process. Yeah. So I do a lot of damage control, I like to say, and I like to put people's minds at ease to say, hey, if it is tense, I totally acknowledge that, because you know why? You're not used to having a finger in your butt. Yeah. You have a female therapist that is working on you and touching you, and there's a lot of dynamic to that. And so I think just acknowledging that and saying like, I'm not going to take that with full conviction or full fact, because that will change. Yeah. It changes based on context, and my role is not to feed into that, but to say, hey, things change, and let's kind of get you to feel that in your own body. And I have them work with their own tissues and stuff. So, so I guess, again, being candid, it's being honest, it's being transparent, and it's being grounded in your comfort level as a practitioner, because the person in the room is feeling your energy. And if you're nervous, you know what I mean, right? We've all been in those situations.
Absolutely. Well, good for you that you do that. So, okay, so now they've been seen by you. The guys that are listening, they know what to expect. Hopefully they'll get a doctor like you, and she'll be like really open and very nice, and kind of put them at ease. So the exercises that you might have them do, or you teach them to do, in order to sort of correct the situation or make things better. So tell me some of those exercises that you ask your patients
that's
to
great.
do.
Yeah, awesome. Great question. So the types of treatment strategies or approaches that I might use in a session, again, it will vary based on biology, psychology, and social aspects of that person's experience, and really what their goals are. So a lot of the treatments are tailored to, they're all tailored to that person's individual needs. So for example, if they are having fear or anxiety around sexual performance, or getting an erection because it hurts, or after ejaculation, again, I tend to use sensory integration or safe touch with themselves or with their partner. I'll show them on their bodies. I'll show them on models of like, let's map out pleasure areas of your body, and then let's kind of work with the bits that hurt, again, in a non-threatening way. So we do some sensory work around that, safe touch, soft, massaging of the areas. Sometimes I use different textures, or I'll have them use different textures, like even a masturbation sleeve or a penis sleeve, because it has has a different texture, pressure. So really what you're trying to do is get tissues to feel comfortable with a certain amount of touch, a certain amount of friction, a certain amount of load. I'll also have them do breathing techniques. So breathing is a tool that they can use anywhere, anytime, and they're very helpful for when there's like a flare-up, or when there's anxiety or anticipation of something being painful, especially when they're exploring, their willingness to explore pain in different ways. So breathing is a huge tool, and just breath awareness, mindfulness, awareness. So I help them with that, and body awareness. Another thing, we do a lot of body scanning, progressive muscle relaxation techniques, where they can feel in control of tension on, tension off. Really it's all about having them build a toolbox of strategies to help them feel more in control, or more capable of dealing with a stressful situation.
All right.
Right?
Yeah.
So those are some of the things we do. So sensory integration, whether that's through touch. I mentioned movement. Sometimes I'm a yoga teacher, or yoga trained teacher, so I can also use yoga in my sessions, or
Great.
parts of movement. So I do I love movement and muscle resistance type training, and just getting someone to feel sensations in their body in a different way, without associating things as good or bad, or pleasant or unpleasant. Just, it's really about like, see how things always change, and things are not permanent. Let's see if we can change that experience that you have in your body in a more positive direction. There are all sorts of things, pelvic contractions, strengthening exercises if appropriate, right? Like tensing, Kegels, right?
All of that.
Or sexing their flex, right? Like, or flexing their sex. Flexing their sex. But yeah, that could be something, again, that's appropriate for them to just, again, get more greater body awareness and kinesthetic awareness of what's happening in their body, so they feel more in control and safe. So,
So what's the typical time frame? So I know I've had, physical therapy on my ankle. I broke both of them before and all of that. So I've had to have that. But what's the typical time span that you would suggest that a patient come to you to get help? So would it be over a course of, would they have to continue to come back to you every week to kind of exercise these things, or how does that work?
Good question. So how frequent does someone see me, or what's the course of action in terms of frequency of treatment? So it depends. It depends. I know I don't have a concrete answer. It depends. Right. Yeah. I say it depends on the person, because some men might need more support earlier on. So that would mean more sessions, and typically are there weekly sessions of an hour each. We can, again, that might mean a little bit more hand holding in the beginning, but then, lessening that support as that person's feeling more confident and more comfortable with strategies, and feeling more in control, and have a sense of self-agency, or a sense of agency. But so it might be more frequent in the beginning, and then we kind of taper off. But I'm always here as available support. So I like to tell them I'm here, to guide you. You're driving down the highway, you veer into somebody else's lane, the rumble strips kind of wake you up, and you get back into your lane, right? Yeah, wow. Sometimes you need a coach like that to or they might experience right? Yeah. So they might have a flare or something like that, or they feel like, I've already made this progress. I need to brainstorm, how can I up the ante on moving forward with my progress.
That's great.
And then we'll have a session to talk about that noon. So again, I'm here to brainstorm. I'm here to collaborate, to have power with my client, not power over. And I'm here to support that person in any way that they see fit. Really, it's a
That's
collaboration
awesome.
instead of telling them what to do.
Yeah, that's fantastic. So, so we're about to wrap up, but I just want to make sure that the men that are listening or the women that are listening know how to get in touch with you, or let's tell them about your book real quickly, the name of it, so that they can maybe get it if they want, or how they can maybe go on your website or your In Your Pants podcast that they might want to listen to. So
Mm-hmm.
yeah, just before we go, kind of tell the audience how to reach you and get more information.
Thank you, Tina. Thanks for this opportunity for shameless plugs. So my website is the best way to get in touch with me. It's drsusieg.com. That's drsusieg.com. And on there, you'll find podcast information, my book, Pelvic Pain, The Ultimate Cock Block, which second edition is coming out in a couple of months. So stay tuned for that. And I've got a blog, and also several of the programs that I've created for men who have pelvic pain, and other free resources as well on the website. So,
All right. Well, you've heard it from Dr. Gronski, and I just want to say thank you so much for coming on the show. This has been so interesting, and so
thank you so much.
Yes, I'm so glad that our listeners have had a chance to listen and be educated about this, and I hope it encourages them to, if they're having a problem or an issue, to go and seek help. Don't just stay with it at home and just kind of grapple with it, and you're all nervous and upset. Go and get help, because Dr. Gronski is saying, you can turn this situation around. So
You certainly can. Don't need to live with it for the rest of your life, or, in isolation.
Yeah.
There's no way to live.
All right.
Yeah.
So again, thank you so much, listeners. I hope you've enjoyed this episode of the Lovers Lounge podcast, where we interview experts and other guests on topics related to love, relationships, and sex. Of course, I am your host, Tina Love. And until next time, peace. And of course, love.